right, so this is going to be my week 8 health assessment 2, head to toe final assessment. So first things first, I'm going to walk into my patient's room, knock on the door, provide privacy, do my hand hygiene as I come in. I'm going to acknowledge my patient, introduce myself, let them know what I'm about to do, how long it's going to take, and then thank them for letting me do the assessment. Next, I'm going to ask my patient their name and the date of birth, and I'm going to match it with their ID band. Then I'm going to assess allergies and assess for any pain. So just starting off general appearance, first, I want to make sure that my patient is not in any acute distress before I get started. Once I've established that, I'm going to just go assess their level of consciousness. So first, they should be alert if they're able to talk with me. Obviously, they would be alert. And then I'm going to ask them just a couple questions. So they should be alert and oriented to person, place, time, and situation. So person would be name and birthday. Place would be where they are. Time would be either the month or the year. And then situation would be why they're here, basically in the hospital. And then after that, just kind of through our conversations, I just want to note kind of their behaviors. So I want to note their facial expressions, their mood slash affect, and then I also want to note their speech. So their speech should be clear. Next, moving on to my skin and nails. So I'm just going to start by just inspecting my skin, just starting off. So the color should be appropriate to ethnicity, and then I'm just looking for any lesions, wounds, or incisions. And this would be where you would just kind of go through and just inspect, do your full skin assessment. So after that, you're going to move on to inspecting your nails. So just looking at my nail beds here, they're pink, and then I'm just assessing for any clubbing, which I do not have. You can also perform a Shamrock test just to make sure if there is any question of clubbing, but I obviously do not have any clubbing. So next I'm going to go ahead and just test my cap refill. So I'm going to just pinch the nail bed here, and it should pink back up in less than 2 seconds, and you're going to do that bilaterally. So cap refill, less than 2 seconds. After that, I'm going to go ahead and just kind of palpate my skin temperatures. So I'm going to do, skin temperature. I'm going to do my upper and lower extremities just to make sure that one extremity is not cooler or warmer than the other, basically. So after that, I'm going to move on to my head, face, and neck. So I'm going to go ahead and just start by palpating and just inspecting my head for any lesions or infestations. Next, I'm going to test just a few cranial nerves. So my first one is going to be cranial nerve number 5, which is the trigeminal nerve. So there's a motor and a sensory part to that. So for the motor portion, I'm going to have my patient open their jaw, and I'm going to try and push back up. Okay, so I pushed back up, and obviously I was able to overcome that resistance. So motor part is intact. Sensory, I'm going to have my patient close their eyes. I'm going to take a cotton ball and just swipe it across the side of their face. And then I'm going to ask them which side of the face that I swiped. So then if they were able to tell me that, the sensory portion of that, of cranial nerve number 5 would be intact. Next, I'm going to test cranial nerve number 7, which is the facial nerve. So I'm going to have my patient smile and show me their teeth, or I can have them puff out their cheeks. So smile should be symmetrical. Cheek puffing should be, equal as well. It shouldn't be asymmetrical. Next is going to be cranial nerve number 11, which is the accessory nerve, basically. So what I'm going to do is have my patient shrug their shoulders, and I'm going to try and push down with resistance, and I'm going to tell them to keep their shoulders up, basically. Next, I'm going to just start by rotating my head bilaterally, and that I'm able to do. So cranial nerve number 11 would be intact. Moving on to my eyes. So first I'm just inspecting my external ocular structures for any discharge or any redness, which I do not have. Then I'm just going to pull down my patient's lower lids, and I'm looking at their conjunctiva, which should be pink, and then their sclera should be white. After that, I'm just going to move on to my pupil assessment. So basically, I'm going to take my pen light and just kind of hold it up to my patient's eyes, or my eyes. So pupils are about a 4, but they are equal and they are round. And then I'm going to do my reaction to light. And your pupils should constrict as the light goes in, which they do. And then I'm going to test my accommodation. So let's say there's a clock on the wall. I'm going to have my patient stare at that for a couple seconds, and then fix on of my pen light. So I'm going to have them stare at that and then follow that pen light in, back out, in, and back out. So they were able to accommodate. So PERLA stands for pupils equal, round, reactive to light, and accommodation. After that, I'm going to test cranial nerves 3, 4, and 6. And I'm going to do this by doing my 6 cardinal fields of gaze. So I'm going to hold my pen light out. I'm going to instruct my patient not to move their head, just to follow the pen light with their eyes. So I'm going to go out. Okay, and obviously I was able to do that. So cranial nerves 3, 4, and 6 would be intact. So moving on to my ears, I'm just going to start by just inspecting for any discharge or any redness. So I'm inspecting the external auditory meatus, and I'm just going to do that on both sides. So no discharge or redness on either side. So next I'm going to test cranial nerve number 8, and I'm going to do this by performing a whisper test. So basically, if I was standing on the left side of my patient, I'm going to stand kind of right behind my patient, have them cover their right ear, and I'm going to whisper in 3 words. So I would whisper in 1, 2, 3, and have them repeat that back to me. And then after that, I am going to switch sides. So I'm going to come on this right side. So I'm going to stand kind of right here, have my patient cover their left ear and whisper in 4, 5, 6 and have them repeat it back to me. So if they were able to perform that whisper test, then cranial nerve number 8 would be intact. So moving on to my nose, I'm going to just start by inspecting the internal structures, basically for any inflammation, any deformities, or any asymmetry or like deviated septum or anything like that, which I do not have. You can also assess for drainage at that time and just make sure that there is no drainage, but there isn't. So next I'm going to assess for bilateral narrow patency. So what I'm going to do is have my patient just close their nostril and breathe in and out. And that was, both nares were patent. So that's what I'm looking for. So after my nose, I'm going to go ahead and move on to my mouth and throat. So basically I'm just starting off by inspecting my lips. They should be pink and moist. I'm going to have my patient stick out their tongue. Tongue should be pink and moist, and then I'm going to look at their gums. So I'm going to just kind of take you could take like a gloved finger and just kind of look in their gums, which are pink and moist, which is what I want them to be. So next I'm going to test cranial nerves number 9 and 10. So I'm going to test the glossopharyngeal nerve and then the vagus nerve. So what you can do is have your patient stick out their tongue and say ah. So ah. And then you're going to put a tongue depressor back in the back of their throat, and you're going to elicit a gag reflex. So if you're able to do that, then cranial nerves 9 and 10 would be intact. And then lastly, I'm going to assess cranial nerve number 12, which is the hypoglossal nerve. So what I'm going to do is you can have your patient stick out their tongue again and just move it side to side. And then you can also have them say light, tight, and dynamite and just kind of note those enunciations. So if they're able to do that, then cranial nerve number 12 would be intact. Right, so moving on to my respiratory assessment. First, I'm just going to inspect the anterior chest for any accessory muscle use, and then I'm going to move on to auscultating my patient's lung sounds. So I'm going to do my anterior chest first, and then I'm going to use my board for my posterior chest. So this is going to be my right upper lobe, left upper lobe. This is going to be my right middle lobe, right lower lobe, and then left lower lobe. And I would be listening over bare skin, and then I'm going to be moving in like a side-to-side pattern, how I just demonstrated. So I'm going to go ahead and listen to my posterior lung sounds. See that. And then same thing, I would be listening over bare skin and a side-to-side pattern on inspiration and expiration. So it's going to be my left upper lobe, right upper lobe, left lower lobe, right lower lobe, and then I could even go further to my right lower lobe and left lower lobe. So then after I finish up my respiratory assessment, I'm going to go ahead and move on to my cardiac assessment. So I'm going to go ahead and just assess my carotid pulses sequentially. And those are 2+ bilaterally. Next, sitting at a 90-degree angle, I'm just assessing for any JVD, which I do not have. So then after that, I'm going to go ahead and just assess for any edema. So just kind of palpating through, don't have any edema on my hands or my arms. I would just kind of go through and just palpate in like my shin area, kind of ankle and foot. So I don't have any edema here, nor do I have edema on this leg either. So I'm just palpating through, so no edema present. Then I'm going to go ahead and just listen to my heart sounds. So I'm going to go through and just listen with my diaphragm and my bell. I'm going to do my diaphragm first. So I'm going to go ahead and just demonstrate that. All right, so this is going to be my aortic, and this is going to be second intercostal right sternal border. This is going to be pulmonic, second intercostal left sternal border. This is going to be my Erb's point. third intercostal left sternal border. This is going to be my tricuspid, fourth intercostal left sternal border, and this is going to be my mitral. So left midclavicular line, fifth intercostal space. Then I'm going to go through with my bell and just make sure that I don't have any murmurs. So this is going to be aortic, pulmonic. This is going to be my Erb's point. This is going to be my tricuspid, and then my mitral. So then after listening to my heart sounds, I'm going to go through and just palpate my pulses. So here is my radial pulse over here, and I would be doing this bilaterally at the same time. So those are 2 plus bilaterally, and then I'm going to go ahead and just move on to my dorsalis pedis here. So here is my dorsalis pedis on this side on my left. It's 2 plus. And then on my right, this one is 2 plus as well. And I would be doing this at the same time. Then I'm going to move on to my posterior tibialis. So this one is 2 plus. And then this one is 2 plus as well. So you would just want to be doing that bilaterally as well. So then after my cardiac assessment, I'm going to go ahead and just move on to my GI/GU assessment. So just by inspection, so I do kind of have like a rounded contour, but my abdomen is symmetrical. So after I establish that, I'm going to just go through and listen to my bowel sounds. So this is my right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So bowel sounds are active in all 4 quadrants. And then after that, I'm going to go through and just do some light palpitation. So right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And then while I'm doing that, basically, I'm just assessing for any distension or any tenderness. All right, moving on to my musculoskeletal assessment. I'm going to go ahead and I'm going to assess. So I'm just inspecting my 1 major and 1 minor for upper and lower extremities. So I'm going to look at symmetry and contour. So I'm going to go ahead and do my elbows. So they are symmetrical bilaterally. Contour is good bilaterally. And then I'm going to look at my wrist. So they are symmetrical bilaterally, and then contour is good bilaterally. And then for lower extremities, I'm going to do my knees and my ankles. So my knees are symmetrical bilaterally, contour is good bilaterally, and then I'm going to go ahead and do my ankles. So symmetrical and contour, and then I'm looking for symmetry and contour, which they are symmetric bilaterally. So next, I'm going to go ahead and just test my range of motion. So for my elbows, so I'm going to do flexion and extension, and then I'm going to do supination and pronation. And then for my wrist, I'm going to do flexion and extension, and then hyperextension. For my knees, I'm going to do flexion and extension, and then for my ankles, I'm going to move my camera down. But for these ones, for my upper extremities, range of motion was good bilaterally, and then for my knees, range of motion was good bilaterally. So I'll go ahead and move this down and do my ankle range of motion. So just starting out, you can do inversion and eversion, and then you're going to do plantar flexion and then dorsiflexion. So that range of motion is good bilaterally as well. So next I'm going to assess my patient's sensory function. And what I'm going to do is I'm going to have my patient close their eyes. So I have a Q-tip, I have one sharp side, and I have one dull side. So I'm going to have them close their eyes, and I'm just going to assess. So that would be the sharp side, and then go again. That's going to be my dull side, and then you can also do it on the upper extremities. So that would be my sharp side, and then that would be my dull side. So just have them state which side you're basically touching. So then after that, after I assess my sensory function, I'm going to assess my motor function. So I'm going to have my patient squeeze my fingers, and I'm going to test their grip, and then I'm going to have their patients hold their arms out like this, and I'm going to push down and have them resist against me. So then after that, I'm going to test the lower extremities. So I'm going to have them do plantar flexion. So they're pushing down on my hands, and I'm going to try and pull their feet up, and they're going to resist and keep them down. And then for dorsiflexion, I'm going to have them pull up on me, basically push my hands up, and I'm going to push them down, and they're going to try and resist back for that. And then I'm going to assess their gait. So what I'm going to do is you can perform like a Romberg test if you need it for kind of more coordination, but for gait you're just going to have them kind of walk to the door and back, and then their gait should be smooth and upright, and just note if they use any assistive devices. Then after I complete my musculoskeletal assessment, I'm going to reassess my patient's pain. I'm going to offer them any comfort measures. I'm going to make sure that they don't need anything before I leave the room. I'm going to do my hand hygiene, and then I'm going to thank my patient. I'm also going to make sure that the side rails are up at least ×2, bed is in the lowest position, wheels are locked, and then the call light is within reach. And then that wraps up my assessment. I'm just going to do my hand hygiene on the way out.